From Montana's news leader, this is the MTN 530 News.
Good evening, everyone. Thanks for joining us. I'm Jeanelle Slade. Well, tonight, frustration surrounding the lack of COVID-19 vaccine. Local hospitals and clinic phone lines overwhelmed with thousands of calls, patients eager to get vaccinated. While this week's vaccine supply to Yellowstone County is less than half what was expected. Well, Yellowstone County health authorities announced today that the county will receive less than 1,100 vaccine doses this week. That is less than half of what Billings Clinic requested, and St. Vincent Healthcare got shut out completely. Well, last week, Billings Clinic, St. Vincent, and Riverstone Health were allocated a combined total of 2,100 first doses. Appointments filled within a few hours at all three facilities. Yellowstone County Health Officer John Felton calls this allocation across the state this week disappointing, woefully inadequate, and unpredictable. Well, there's no shortage of demand for the COVID-19 vaccine in Billings. Staff at the Billings Clinic today received thousands of calls from people wanting to get their shots. But the hospital says it only received 975 doses. Q2's Mitch Laggy brings us more.
In the first 3.5 hours of business Monday, staff at the Billings Clinic answered 27,000 calls from people wanting to get their COVID-19 vaccine. Some people waited on the line for 30 minutes or more. An additional 35 staff members that the clinic hired last week just didn't cut it. Now they're looking to a third party to answer the phones.
We're just totally overwhelmed here with our own resources. I mean, we still have to schedule patients for surgery, for clinics, for transfers in. So we feel that it would be important to have someone that deals with these types of heavy call volume events and to set it up separately.
Demand for the COVID-19 vaccine still far outweighs supply. Of the state's 13,500 allocated doses this week, the clinic received 975. Staff said the Billings Clinic has the capability to administer 120 vaccines per hour, but they just don't have the supply.
We're at the mercy of the national distribution. This is not a state of Montana issue. It's not a Billings Clinic issue. It's a federal issue. There's just not enough supply yet.
To get a vaccine at the Billings Clinic, you'll need to obtain a medical record number. Current patients can find their number on their most recent bill statement, and new patients can call the records department to get one started. Once you have a record number, head to billingsclinic.com/patientconnect to schedule an appointment. This week, appointments are still open for Tuesday and Wednesday. The phone line's open at 8 a.m. sharp. Reporting in Billings, Mitch Laggy, MTN News.
All right, thanks so much, Mitch. Now, at the rate the vaccine is trickling into Yellowstone County, it could take more than 2 months for all people in Phase 1B to be vaccinated. While the clinic received less than 1,000 doses this week, St. Vincent Healthcare will receive none. When asked why, the hospital did not address that question. In a statement attributed to the hospital's chief operating officer, it says St. Vincent has the ability to administer more than 1,000 doses each week, but because the hospital did not receive any vaccine, it will not be able to hold any appointments this week. Well, we are now in the Phase 1B tier of vaccinations, which includes all people 70 years and older, people 16 to 69 with high-risk medical conditions, and American Indians and other people of color. Well, as of today, you can actually track how much vaccine is or is not coming into the state and how quickly healthcare teams are getting people vaccinated. Governor Gianforte launched a new statewide COVID-19 vaccine dashboard today. So far, it shows more than 77,000 vaccine doses have been administered and nearly 15,000 Montanans are fully immunized. Increases in numbers, of course, are dependent on supply. That dashboard can be found on the State Response COVID-19 website. Well, the statewide COVID-19 related death toll has now reached 1,165. The additional deaths are a result of 14 reported deaths from Missoula County today. Missoula County Health Authorities say 13 county cases previously counted as recovered are now classified as deceased. Those deaths span October through December of 2020. Nearly 87,000 Montanans have recovered. Well, statistics like these have made for a difficult and challenging year for healthcare workers. They're experiencing exhaustion, heartbreak, illness, and more as they fight through this pandemic. But as MTN's Jill Valley reports, in spite of it all, people are stepping up to join the fight.
If you didn't know what a respiratory therapist was before the pandemic, you probably do now, as they're saving lives in the fight against COVID. It's a battle attracting many new healthcare heroes.
We have seen an uptick in interest in healthcare careers in the wake of the pandemic. I think a lot of students are looking around thinking, I want to be part of the solution.
At Missoula College, the pandemic does not seem to be scaring students away. Enrollment is robust in the 6 healthcare programs offered. Learning in a pandemic can be tricky, but also unique.
One, we still get to go to clinicals and we still get to physically learn from doing. And especially with everything going on with COVID, we're learning a lot of those safety precautions, and it's very real. There's a lot of hands-on learning, and even with the safety nets that we have with the masks and the gowns, and students aren't, going into the COVID rooms themselves. We get to learn by doing in this program rather than by watching, and I really enjoy that.
Many students come to Missoula College's healthcare curriculum already trained as a CNA or an EMT. It gives them a competitive edge, but more than that, it gives them a glimpse into the real world of medicine that isn't always pretty.
Some students all they know about healthcare is they watch Grey's Anatomy, and they really aren't familiar enough. So getting a little of that basic entry-level experience, it really dispels any kind of false notions they may have about healthcare. When you're showing up at 7 a.m. to take care of sick people, you're going to figure out really quickly if healthcare is for you.
And the jobs are out there. Students often graduate with employment waiting for them. Missoula College is also looking into more outreach to rural areas of Montana.
Rural areas have the greatest shortages, and we're trying now to get some programs going to support Native American students, especially those that want to return to their reservations to provide healthcare assistance. We're finding we're making more of an effort to recruit students into rural facilities.
What Dan Funch sees is enthusiasm and a drive to succeed.
Whether we're talking about here in Missoula, throughout Montana, or nationwide, students with health degrees, they'll find that they're not necessarily lucrative, right? You're not going to be rich, but these jobs are very meaningful and they're very productive, and it's very easy to get employment in almost any place you'll look.
In Missoula, Jill Valley, MTN News.
All right, thanks so much, Jill. Today, Republicans in the Montana House endorsed 4 bills to restrict or further regulate abortion in the state. And the House also voted for a pair of bills that would restrict the activities or treatment of transgender youths as school athletes across Montana. Well, the House voted 62-38 for a bill that says school athletes in Montana must compete on teams that align with their gender at birth. And on a closer vote, 53-47, it endorsed a bill barring anyone under 18 from getting any treatment or surgery for a sex change. The abortion bills won endorsement on straight party line votes of 67-33, with Republicans in favor and Democrats against. The bill would ban abortions in Montana after 20 weeks of pregnancy, greatly restrict the dispensation of abortion-inducing drugs, and require doctors to ask women if they want to view an ultrasound of the fetus before performing an abortion. Opponents of the bills say they are unconstitutional and will be challenged in court. Democrats also warn that the transgender bills will create an anti-discrimination backlash that hurts the state economy. Well, the bills face final House votes this week, and if those succeed, will go next to the state Senate for consideration. Well, both pro-life and pro-choice advocates weighed in on the anti-abortion legislation that passed the State House of Representatives earlier today. Lawmakers in the House advanced the legislation on the same day as the annual March for Life rally. The rally seeks to end the practice of abortion. Earlier today, pro-life demonstrators gathered at the state capitol, and another digital rally was held due to COVID restrictions. Anti-abortion groups praised the legislation and are optimistic about furthering more anti-abortion issues after 16 years of Democratic governors.
We have larger Republican majorities in both the House and Senate than we've had in the past. Plus, we now have a governor that says he is pro-life as well, Governor Gianforte. So we're now hopeful that we're going to have a different outcome than we've had the last 16 years.
And Montana pro-choice advocates have said if the legislation were to become law, they would challenge it in court, noting that similar abortion legislation in Arizona and Idaho have been struck down in federal court. Well, up next on tonight's MTN 530 News on Q2, why journalists from around the nation are coming together to help promote healthier news consumption. And later, it's a family affair when it comes to wrestling at West High.
The almanac today just a little deceiving. The 21 that's shown for a daytime high was actually the temperature at midnight. It's been in the teens for the rest of the time, and we picked up just some light snowflakes. We'll let you know what's up next with the forecast.